Hey, deserved listeners, let's continue watching the trial.
You know that over time, the American Psychiatric Association has amended the rule, so it's not just about diagnoses, but it's also about professional opinion.
Could you be more specifically say about professional opinion in regard to what?
The cross-examination lawyer is going down the Goldwater rule route, which is a good idea. And I'm curious to see what happens here because he does need to be confronted on this, I believe, in my opinion. And the way the attorney is asking, he's saying that not only does it apply to diagnosing from afar, but also providing professional opinion. Side note, someone emailed me recently and you got to talk about this guy because he is diagnosing from afar seemingly. And of course, you're always doing, to me, the person saying, Kirk, you're always doing this when you're doing your different reaction videos. You're always diagnosing from afar as well. So, maybe you should chime in on that. And I'm like, I've literally never diagnosed from afar. And I think it might be a misunderstanding of language that when I am watching a show, or even this, let's just use this, and I say something like, borderline is this, this, and this, and Amber Heard shows signs of this, this, and this, I'm not diagnosing her. I believe I almost always will say, I'm not diagnosing her because I don't know her, but that sure looks like a sign of it. And you'll hear me use language, and it might be painful, honestly, to hear me use this very careful language sometimes, but it's the way that I think, by the way. I will say things like, if I were to assess Johnny Depp, then I believe I would find it fruitful to go down a hypothesis exploration around this or that. So I guess some people, when I say that, they think I'm diagnosing someone. I am not. I'm very careful to phrase it the way that I think, which is I have no idea what is going on with these people, but I use these examples as a jumping off point so that I can talk about these things in general. I've been podcasting for 14 years, and I am extremely buttoned up about my ethical guidelines and codes and behaviors. I don't know why this is exactly, but I've always been extremely concerned. Maybe it's because early in my career, I actually had some problems on accident with a couple ethical situations. It wasn't atrocious. And I also have been a supervisor for over 20 years. And so when I'm supervising clinicians, there's a lot of questions that they'll ask me about ethics. There's a lot of situations they run into about the law and ethical codes and their licensing. And if I don't advise them right, then I could lose my license and I could be sued. So I have always been extremely buttoned up about these sorts of things. Thus, throughout the entire time of this podcast, I have been very careful to never have an ethical violation committed by me on this podcast. I've consulted with experts. I have lawyers who look over things. And this one particular lawyer that looks over things, she's also a clinician. And so she's a lawyer and a clinician. I just want to make that clear. I'm sure most of you get that. And for those of you who don't get that, know that. That I am not breaking the Goldwater rule. My goodness. To think that people think that I'm doing that, is one of the worst things I could imagine people thinking about me. So he is asking about professional opinion because I think he's trying to expand the Goldwater rule to include not only diagnosing a politician from afar, but also providing an opinion in court having never evaluated Johnny Depp.
It is unethical for a psychiatrist to offer a professional opinion about an individual based on publicly available information without conducting an examination. That's the rule, right?
If you're reading it directly, I will believe you.
Okay.
Now, the other thing that I'll say about the Goldwater rule, and really all things in ethical codes, is there's a gray zone. There are situations in which, and I've talked about some already, but say you have research subjects. You are doing a research study on 1,000 different people and you're studying depression. And you don't have time to do 1,000 different 3-hour interviews with each person. And so you will do short little surveys that people will fill out. And you're not officially diagnosing them, meaning that they wouldn't take that to their insurance. But in terms of the participation in that research study, you're identifying that person has depression. You might ask a lot of other questions like, have you been diagnosed with depression before? These kinds of things. But in order to conduct research on a particular diagnosis, sometimes that sort of thing will happen, and it's heavily reviewed by outside authorities to make sure that your research design is not dubious in some way. So there is oversight to that. But, there's a lot of situations where one would diagnose from afar without having a direct interview with that individual. I would say, though, that this does not count. But he probably thinks that it does count, but I don't agree. And another issue here is that whenever it comes to ethical codes and the interpretation thereof, you'll get different opinions. And when I first started out as a clinician, this really bothered me. The first example that I was told when I was taking my very first ethics class 26 years ago was the professor was saying that in Washington State, if a 17-year-old comes into therapy, they have confidentiality, meaning that if the client doesn't provide written consent, you cannot speak to anyone, including their parents, right? But they said if the teenage girl tells you that she is abusing cocaine frequently and you don't tell the parents because of confidentiality, naturally, but then let's say the teenager dies from cocaine and then it's later revealed that you did know she was abusing cocaine and you didn't tell the parents. The parents could sue you because you didn't alert anyone. And I said, okay, so if they're using cocaine, we do tell the parents? And the professor was like, well, maybe, but maybe not, because if you do tell the parents, the teenager could sue you. And I'm like, so if I tell the parents, I could get sued. And if I don't tell the parents, I could get sued. And he's like, correct. And I'm like, so what are we supposed to do? And there are so many different instances like that. And this is one of them, you could argue, because you have some, and we decide our own ethical codes. They're not handed to us by God or something. We decide as a profession, and there are different ethical codes within each profession. The other thing I'll say is that the Goldwater rule applies to psychiatrists officially, but unofficially it applies to all clinicians who diagnose. And some people will say our ethical codes do address this to some extent in psychology, marriage, family therapy, counseling, social work, but they don't have as strict of a rule as the Goldwater rule, and there isn't language around that. But generally speaking, the way that we operate as diagnosticians in mental health is we all consider the Goldwater rule to be standard to our ethical codes, but you might have some people that don't see it that way. So it's a squishy world. Having said that, like I've been saying from the beginning, the things that Dr. Hughes was doing, the things that Dr. Spiegel was doing, I was being trained specifically not to do what they are doing. I was trained to do what Dr. Curry was doing, which is to say, I can't answer that question. I wasn't evaluating that, and it would be unethical for me to speculate. Dr. Spiegel, Dr. Hughes, in my opinion, went way outside of that.
However, a diagnosis is not required for an opinion to be professional. So my question is, it's not just diagnosis that this Goldwater rule applies to, it's professional opinions.
So again, I'll reiterate that would come down to essentially nullifying witness testimony, expert witness testimony, without direct evaluation. And as we know, it didn't happen. But regardless of that, the whole expert witness testimony thing would be basically rendered null.
And I mean, I wouldn't go that far, but it would eliminate many of the statements made by these expert witnesses, such as the ones that have been made against Johnny Depp. And I would say that would be fine. What Dr. Curry did was only comment on Amber Heard. She never said Johnny Depp had this or didn't have this. She didn't comment on intimate partner violence happening or not. She could only speak to what was reported, what she found in her testing and in her interviews. And that was what I was trained to do.
The rule, in fact, contemplates that issue, doesn't it, sir?
Again, I'm just telling you the answer to the question. When you're reading me those statements, I'm telling you the response by the other side, who publishes also, is that if that was the case, there could be no expert witness testimony in the courtroom.
No. It would just be limited to those expert witnesses who had access to the individual that they are diagnosing, and the access that they had is sufficient such that they could be confident in a diagnosis, like Dr. Curry. So it wouldn't eliminate forensic psychology or psychiatry in the least.
Psychiatrists are ethically prohibited from evaluating individuals without without permission or other authorization, such as a court order. That's the rule, right?
Again, if you're reading that, then I have to believe you're not misrepresenting it. And I would come back to, again, then this whole thing on expert, we might as well get rid of all the expert witnesses we've had throughout all of time.
What? That's just... No. He's just talking about diagnosing people that you haven't ever talked to. If he made the following argument, then I think you would have a fair amount of support from people in his camp. If he were to say something like, yes, so it is true that that's a guideline in our field, but I wasn't just watching him on screen or seeing a politician. I had a lot of information and I was very meticulous, and it took me several hours, many days of reviewing video footage, audio footage, interviews, documents of interviews, statements made by Johnny Depp, the texts made by Johnny Depp, other collateral the notes of the therapists and counselors and psychologists, the depositions of those individuals. I reviewed all of that. So I'm not just looking at Barry Goldwater or Donald Trump or Barack Obama on TV and diagnosing them officially. I'm basing it on a lot of information. If he said that, I think a lot of people would say, okay, not me per se, but at least I would concede that some people would agree that that is not unethical.
Court proceedings, because what you're saying is unless a court orders it, and that's what you just said, or the APA said, then therefore expert witnesses cannot do an evaluation based on an observation of the medical records. Insurance companies cannot do evaluations solely based on the medical record where their doctors rendering professional opinions. So at the end of the day, you are essentially saying that unless someone has directly evaluated.
Right, that's another point, that you will have auditors and insurance companies that will look at records and will question diagnoses, and there will be clinicians that will be the auditors without ever talking to the individual. I think he could do a better job like upholding what he has done thus far. He's just kind of bringing up these minor arguments to bolster his side. So I'm guessing that the jury is probably swayed towards Johnny Depp because he is not very good at defending himself in this situation. And like I said, from the beginning, there were moments with Dr. Hughes and with Dr. Spiegel that I was like, what are you saying? Particularly what he was basing the narcissistic personality disorder diagnosis on. I mean, my goodness. 1, diagnosing from afar. 2, a personality disorder from afar. 3, the data that he cited as his justification was absurd. Now, maybe he didn't get a chance to say all of his justification, but it didn't look very good to me.
For that. Narcissistic personality trace is not a diagnosis. The answer is no. But if you want to tell me that substance use disorder is a psychiatric diagnosis, the answer is yes.
But that wasn't it.
Okay, so I haven't been showing you all the clips. They've been just kind of arguing with each other. He's just not very good at defending himself, which is interesting. But right now he's being asked about, so you're saying that you did not diagnose Johnny Depp. Is that what we're hearing? Because I think that catches him in this catch-22, whereas if he says, right, I did not diagnose Johnny Depp, then basically everything he said, or a lot of what he said, he's basically saying, I didn't really say those things, or I wasn't saying them officially, or I was just kind of daydreaming about those things, speculating those things. And I don't think he wants to say that. And then on the other hand, if he says, yes, I am diagnosing him, then that's potentially a violation of an ethical code. And so he's being asked, did you diagnose? And he's like, well, 1, intimate partner violence is not a diagnosis, which is true. It's still, though, highly speculative. It's even worse to some extent, because at least with diagnosing, we're trained as clinicians to diagnose people, and it's possible to be confident and competent in a diagnosis from afar, having gathered a lot of collateral information. But we are not trained at detecting whether or not someone is lying, because that doesn't exist, or being able to detect what really happened based on descriptions from other people. If we were trained in that, we wouldn't need the criminal justice system. We would just talk to suspects and be able to figure out exactly what happened. That's just not possible by any human. So it's not a diagnosis, but it is extremely speculative, and without stating it as such is unprofessional in my opinion. Then he says, I didn't diagnose him with narcissistic personality disorder. I diagnosed him with narcissistic personality traits. Okay, so on one level, could someone argue that that's not a diagnosis? Not in my book. It's like a physician saying that they can look at someone without doing an examination and say, I know that that person is precancerous or something. They don't have cancer yet, but they're precancerous. Now, one could argue that's a diagnosis, but it's a similar thing. Then he says, but with substance use disorder, yeah, that is a diagnosis, because it is, and I am diagnosing from afar with collateral information, which I've been saying from the beginning, I would understand. I wouldn't do personally, because I'm pretty strict about these kinds of things, but one could reasonably conclude, based on just even information that he has stated publicly and in this trial, that he has in the past, we don't know about in this moment, suffered from a substance use disorder, because it's just not hard to diagnose people with substance use disorder because, as I explained earlier, the bar is extremely low. A lot of people qualify for a substance use disorder diagnosis. Johnny Depp almost certainly. Plus, he's been treated for substance use disorder. He's admitted he has a problem. So you could reasonably diagnose from afar with collateral information substance use disorder, but not narcissistic personality disorder, particularly the example that he gave. And you cannot speculate about who was abusive when you hear two people reporting completely different stories.
There's a difference between admitting to substance use and substance use disorder.
Let's go back to what you just said about narcissistic personality traits.
Yes.
Narcissistic personality disorder is a DSM-5 diagnosis, correct?
Correct.
Diagnostic personality, and you haven't testified that Mr. Depp has narcissistic personality disorder, have you?
I would certainly, if I didn't, I'm certainly thinking that, but at least I'm going to say he has traits which are characteristics of provisional diagnosis of, it's a provisional diagnosis probably of narcissistic personality disorder.
Okay, so that's a diagnosis. A provisional diagnosis is a diagnosis. You're not saying you're sure about it, but that's a diagnosis. I have a hard time believing that most clinicians, particularly experts in personality disorders, would buy what he's saying here. Now, again, if he said, I have a lot of experience with this, I have a lot of collateral information, and based on all that, I'm confident in X, Y, and Z. I'm guessing that a lot of people would support him in that. None of the people in my circle would. But instead, he keeps arguing these other points. If he was to convince me, these points that he's bringing up aren't convincing.
But yeah, I mean, I do believe that.
Well, when you say provisional diagnosis, you know the DSM-5 requires, in order to find that diagnosis, 5 of the 9 factors. Mm-hmm. And you haven't done that analysis. You've never made that diagnosis. You've just identified certain factors
that are criteria for the diagnosis.
Right. But you need 5 of 9 to get to the diagnosis. You've already told us that you didn't make a diagnosis. You're just identifying traits, correct?
Yeah. Where did they get this guy? Because he doesn't seem to know. If you put Dr. Curry in the seat and you asked her these questions, she would have extremely well-rehearsed answers to these questions, because these are standard cross questions. And he seems lost to me. I don't know. I've been suspecting this from early in his testimony, and this is pure speculation, of course, that the Amber Heard team shopped around and they couldn't find people to say what they wanted to say. They found this guy who was willing to say what they wanted him to say because he doesn't understand the landscape. He seems completely lost in terms of how to respond to these questions. But I don't know, maybe he's sly as a fox and he knows everything.
I'm identifying traits that are consistent with the diagnosis, yes.
Right. And did you testify in deposition that the existence of traits...
Now, I want to be clear, because I get attacked from both sides. The Amber Heard people will attack me. The Johnny Depp people will attack me. So I'm not saying that Dr. Spiegel's presentation here somehow negates Amber Heard's claims. I'm just commenting on his performance on the stand. Yeah, that's all I'm saying.
As opposed to the disorder, doesn't have a correlation with IPV.
If I said traits do not have a correlation with if that's what I said, and I don't remember saying that, but that wouldn't be a correct saying. Narcissism has a correlation with the diagnosis. Yes, that part's true.
All right, how far are we going to back this up? Because there's a diagnosis of narcissistic personality disorder, right?
Yes, sir.
And that one has some correlation with IPV, right?
Narcissism has correlation with IPV. Again, sir,
Now, to be clear, lots of things in the DSM are correlated with IPV. Maybe many of the personality disorders, certainly narcissism, borderline, psychopathy, antisocial, guessing histrionic. I'd have to look up the research, paranoid personality disorder, all the substance use disorders. I don't know about cannabis use disorder. Depression might be, anxiety might be, PTSD might be. But does that mean that people with narcissistic personality disorder are always abusive? No, absolutely not.
you're not allowing me to answer. You're splitting hairs. You're splitting hairs between the traits that are consistent with, which all I'm commenting on is behaviors and traits that are consistent with the diagnosis and Mr. Depp. Narcissism absolutely has risk factors associated with IPV.
Let's go back again, and maybe we can focus on the question I.
So I don't know, but I wonder if the attorney doesn't understand the term traits, because if you don't, then you could confuse that with saying that someone actually has the person. You know, if I said that person has narcissistic personality disorder traits, what does that mean to you? I think to a lot of people that means I'm saying they have narcissistic personality disorder. In our lingo, it means you don't qualify for the diagnosis, you are subclinical. So you are someone that has low-grade narcissistic personality disorder, or you have some of the traits but not all of them. Another usage of the term trait is when clinicians will say, I don't know enough about this individual, so I will say they have traits of it, but I don't know enough. Another usage of the term is when we're referring to children and teenagers, because generally speaking, we don't diagnose children and teenagers with personality disorders because their personality is still forming, and there are phases and weird moments in a kid's life where they might look like a particular personality disorder, but we can't know for sure until their personality forms more in a solid way. And we might say that 17-year-old has personality disorder traits. And they could have full-blown traits where they're like, well, they absolutely do qualify. The fourth usage of the word traits literally does mean that. I'm pretty sure Dr. Spiegel isn't using it in this way, where you might say, you have all the traits of this personality disorder. Let me list them, meaning you have the personality disorder, and here are the following traits that you have that are associated with that disorder. So I'm pretty sure he's not using it in that way, though.
Ask you, and we can get an answer that's addressed to that question. Mm-hmm. Narcissistic personality disorder is a risk factor for IPV, yes or no?
Yes.
And you previously testified that there is no literature at which you are currently aware that the mere presence of narcissistic traits is a risk factor for IPV.
Am I answering the question?
Yes.
That's incorrect.
You didn't testify.
There's a lot of research demonstrating that certain aspects of narcissistic personality disorder are associated with IPV, one being entitlement, right? If you just saw that an individual, or you're doing research on individuals in a treatment center for perpetration of intimate partner violence, and you find that there's a greater prevalence of the notion of self-entitlement among that population when compared to the outside control group, then you could say that some of the narcissistic traits are associated with IPV perpetration, that kind of thing. If I were a little birdie in the attorney's ear, I would say there's so many other things you could be slamming in about. I would get off of this one. Or one question I would ask directly to him, I would say, yes or no, are you diagnosing him with narcissistic personality disorder? Yes or no? Because he would say, no, I would hope that he would say no. And I would say, why are you not diagnosing him with the full-blown disorder? And I would try to nail him down and say like that he would say, well, I don't have enough information. Oh, so you don't have enough information to diagnose him with a personality disorder. Is that what I'm hearing? Like I would go down that road. And I don't know how he would respond, but that's what I would say.
Cluster B traits, which narcissistic personality disorder is part of, is a huge risk factor for intimate partner violence, which include, cluster B traits include.
So cluster B, he's talking about borderline and histrionic, which of course has been found present with Amber Heard. Now, he might claim that that's not true.
Narcissistic personality disorder, antisocial personality disorder, amongst others. So the answer to the question is every.
So he left out borderline and histrionic. So it's the first moment where I was like, oh, okay. So he does know what he's doing a little bit.
Source on intimate partner violence will support that cluster B traits, where narcissistic personality falls under, is a risk factor for intimate partner violence.
Any single trait is a risk factor for IPV.
Again, I will repeat, cluster B traits.
He's so, the answer should be yes. He is saying something broader and more comprehensive than what the attorney's asking. The attorney's asking, you're saying that any trait of narcissistic personality disorder is associated with IPV. And then he's like, I'll repeat, all cluster B traits, which of course includes 3 other personality disorder traits. He's saying all of the traits are associated. So he's sort of inadvertently roping Amber in on this situation.
I didn't say any trait. I said cluster. No,
Let me be more precise then.
Okay.
Any narcissistic trait in and of itself is a risk factor for IPV.
Yeah, I don't think he can say yes to that. I could look up the research, but I don't know if there's actual research on that particular question. It's not a very interesting question, really, because we don't usually do that. We don't usually take individual traits of a personality disorder and see them in isolation. It's just not usually what we do.
But you are mischaracterizing what I said. What I said, I'm pretty sure I said cluster. If you look at all the intimate partner violence literature, and I would behoove you to do so, you will see that cluster B traits, I didn't say narcissistic per se, cluster B traits.
I think he's evading because he doesn't have the research in his head and he's trying to be broad. This is just speculative, such that he figures it's probably true. But he's actually saying more than what he's asking. You know, it'd be like saying, are all of the McDonald's in Seattle terrible? And you're like, wait, all I'm saying is all of the McDonald's in Washington State are terrible. I didn't say all of the one. You're like, but okay, but by extension, you're saying that all of the McDonald's in Seattle are terrible. No. You're putting words in my mouth. I said all of the McDonald's in Washington State are terrible.
Narcissistic personality disorder is part of are risk factors for intimate partner violence, part and parcel, uniformly true. And I'm not sure, the thing I don't understand is, I'm not sure why we're arguing psychiatry, because I'm telling you what it is.
Dr. Siegel, you just need to answer the questions.
Okay.
Borderline personality disorder is a risk factor for IPV.
As part of cluster B traits, yes.
Histrionic personality disorder is a risk factor for IPV.
Less so.
But it
less so. Less so.
It's
I mean, it's a risk factor, but less so, yes.
Yeah.
Less so. Significantly less so.
Which traits under narcissistic, before I move on there's only been one diagnosis in court of personality disorders, correct?
Okay, I'm interested to see where this goes, because the answer, of course, is yes. Dr. Curry has diagnosed Amber Heard with 2 personality disorders. What Dr. Curry would say, what would Dr. Curry do? I'm pretty sure what she would say is correct. The other expert witness diagnosed blah, 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 but I found that it was not true. So if he were smart, he would say, correct, Dr. Curry diagnosed her with this, but Dr. Hughes said she did not qualify for that. And my professional opinion is what Dr. Curry was basing her diagnosis on was dubious.
I'm not sure who you're referring to. Are you referring to Mr. Depp, Ms. Hurt? I'm not sure what you're talking about.
Do you understand that there was a medical examination done of Ms. Hurt?
Yes, I did.
Do you understand that the testimony was ultimately that Ms. Hurd suffers from 2 personality disorders?
Okay, so I'm just being specific. I just wanted to know if you're talking about Ms. Hurt or Mr. Depp. So that's all I was asking you.
Yes or no to my question?
Which was there's only one diagnosis of, Ms. Hurt was diagnosed with that.
Yeah, and both of the diagnoses.
Okay, good. So he just answered the question. They're back and forthing the whole time, so I expected him to put up more of a fight. But okay, good, yeah.
All I could say is that cluster B traits, and I'll tell you what they are. And by the way, I testified this before, which was that 1, I don't expect perfection from my victims. 2, absolutely there were cluster B traits Ms. Hurt had. Absolutely, Ms. Hurt had.
Given that you've testified to it before.
Wait, did he just say that Amber Heard absolutely has cluster B traits? Did he just say that? Let's rewind that.
1, I don't expect perfection from my victims. 2, absolutely there were cluster B traits Ms. Hurt had. Absolutely, Ms. Hurt had.
Given that you've testified.
Absolutely, Ms. Heard had cluster B traits. Absolutely, she had it. The lawyer should capitalize on that statement. He is agreeing with Dr. Curry and disagreeing with Dr. Hughes. And I'm guessing that Amber Heard's lawyer, who was paying very close attention, just had her heart drop when he said that and is happy that the attorney didn't seem to catch that because they were in the middle of talking over each other. Either way, it could come across like he was saying that, but I'm pretty sure that's what he's saying, which just points to the fact that he isn't, I don't know what word to put to it, but he is not great at this job. Now, I will say this again, I've said it before, people are online bullying him. Not okay. You could argue I'm doing that right now. He doesn't have to watch this video. He does have to deal with negative reviews. He does have to deal with people calling his office. He does have, vandalism, death threats, whatever. Not okay, 1. 2, another thing that Attorney Craig keeps reminding me of is people online are making fun of Amber Heard's team and saying that they're completely incompetent. And Attorney Craig is a super expert in this issue. He works in the courtroom in trials. He has worked with at least one of the attorneys actually in this room right now, and he highly respects them. He knows when an attorney is doing a bad job, and he says that Amber Heard's team is doing very, very well, as evidenced by the fact that pro-Johnny Depp people hate them and think that they're incompetent. That means that they are doing a good job. If pro-Johnny Depp people thought that they were doing a good job, then that would mean that they were doing a bad job. Does that make sense?
1, I don't expect perfection from my victims. 2, absolutely there were cluster B traits Ms. Hurt had. Absolutely, Ms. Hurt had.
Given that you've
Yeah, he says it twice. Absolutely, Ms. Heard had cluster B traits. Wow. So, okay. One of my main purposes is just my own personal curiosity. Because when you watch the little clips, the little 5-minute clips here and there, it's hard to really understand what's happening. And I'm watching every second of this trial, which I did not know what I was getting into when I decided to do that. It's grueling. But anyway, one of the things that I am curious about personally is what really happened. And so when we hear an Amber Heard team forensic psychiatrist expert witness exclaim twice affirmatively that Amber Heard has borderline and histrionic, or at least traits thereof, and absolutely does, then that lends itself to the Dr. Curry diagnosis. She does have a lot of signs. Does that mean that she is abusive? No. But it does add to the picture significantly if she has particularly severe borderline personality disorder, because you can have a lot of volatility, you can see threats and abandonment and betrayal when they don't exist, or when there are very minor indications that someone isn't close to you in that moment. You can also distort heavily. You will have a hard time emotionally regulating.
Under the rubric of not to invalidate something you did not see. And I'm questioning, I'm asking, so you are talking about expert witness testimony?
No, I'm talking about, do you know the rule?
I'm not a member of the AMA, so I don't,
Okay,
I don't
great.
read the rule.
We can move on. You don't know the rule. All right. You rendered an opinion about Mr. Depp's purported cognitive impairment.
Yes.
Yeah. What do you use as a baseline?
Yeah, good question. I think I literally said that word, baseline. He was watching him in a video deposition or something while he was in the UK trial, I think, and concluding that not only did he have a cognitive deficit, and the other, he also used the mini mental status exam administered by a different clinician, again, a long time ago. Johnny Depp couldn't remember 3 words, which is interesting. I don't know what it means. You would never use a mini mental status exam and say like, cognitive deficit. There's a lot of tests that we have available to us that take a long time to test, and I've administered them. They're basic intelligence tests and memory tests. Then you might conclude something. But even if you did, which is dubious, you would need a baseline to compare to such that you could conclude that he has been affected by something. And then the other layer of that is you would need a lot of data to demonstrate a strong speculation that the drugs and alcohol were causal in that cognitive deficit. So you see the layers there. He looked at a videotape and the results of a mini mental status exam and concluded that not only does that indicate a cognitive deficit, which is completely dubious. I mean, just watching someone give testimony, no way. I mean, unless it was egregiously obvious that the person had something going on. But even then, you'd be like, well, we don't really know what's going on. So not only could you not make that claim, but then to claim that they've had damage to their brain, because maybe he's always had trouble with memory since he was 10. You need some comparison to demonstrate decline. And then 3, to attribute it to his drugs and alcohol use. Now, as I said back then, is it likely, given his drug use, that he has had cognitive decline? Or if someone did do extensive testing and they had a lot of data, could they, relatively confidently conclude that drugs and alcohol have taken a toll on his memory and processing speed? Sure. But based on what he was basing it on, yeah.
A baseline for processing speed?
Yeah, for analyzing Mr. Depp before you watched.
I've seen him interact in public. I have seen him interact with others. I've seen him interact in media. I've seen him interact and his process speed is certainly not slow. I've seen him do commercials. His process speed was not slow.
Okay, then what are you saying? I think, people were accusing him, Dr. Spiegel, of diagnosing him not only from afar, but from watching his movies. And I think this is what they're referring to. But I'm confused because I thought in his testimony, he said that due to drugs and alcohol, he has brain damage. What he was not saying was that he had a temporary cognitive deficit due to current intoxication or withdrawal. That's not what he said, but I think that's now what he's saying, is that I've seen him in other contexts. He even said that when Johnny Depp was testifying earlier in the week, he exhibited lesser cognitive issues or no sign of cognitive. So I don't even know exactly what he's saying. Maybe that's part of the problem. He's just not being very clear. I guess what he's been saying the whole time is that he had temporary cognitive deficits due to current, at the time, intoxication or withdrawal or effects from the drug and alcohol use at the time, and thus that lends itself to the general notion that his testimony isn't very reliable because his brain wasn't working quite right at the time. Is that what he's saying?
To the depositions given in this case.
Then I apologize for what I said. Then I misspoke.
You misspoke? You didn't make the comparison?
Right now, just a second ago? Just a second ago?
He... Kudos to him. There are times when I'm like, okay, good, you just answered the question. And so many of the individuals on cross-examination will be strangely defensive about certain questions when all they have to do is just answer it. But he does that sometimes, I think poorly, and then he doesn't do that sometimes, I think also kind of poorly. He just basically said, well, if I said that, I misspoke. So I'm guessing to the jury, they're like, huh?
But no, any of Mr. Depp's other portrayals in movies, did that affect your analysis of processing speed?
Only I've seen him interact on interviews, and that was it.
Right.
When he wasn't in movies.
Right. But Willy Wonka doesn't matter to you? You see him in that movie, Charlie and Chocolate Factory? Did you look at that one when you were comparing his processing speed?
Do I have to answer that question, Your Honor?
You have to answer questions. Yes.
What is happening? So I think what's happening is the lawyer is, I'm going to argue, being a little combative and unnecessary. But if he's allowed to do it, then, go for it, because it, I'm guessing, does humiliate the expert witness to some extent in the jury's eyes. But I mean, look at everyone, like Johnny's leaning forward, the other attorneys just like, and the people are leaning, they're like, what is going on with this guy? So I think what happened, as they're talking about processing speed, ironically, the lawyer is asking him, did you base it on pirates? And he's like, I misspoke, I'm sorry, I didn't mean that. But to be clear, I can gauge someone's processing speed. And then the lawyer says, so you didn't base it on Willy Wonka? Because I think the lawyer knows that he kind of has him in a bind, and he wants to emphasize it. And I think what happened there was Dr. Spiegel was like, Willy Wonka? Is that a viable question? I feel like I'm being attacked right now because by your facial expression. Is that a viable question? And he doesn't, because he, I don't think, has much experience in this role. He turns, he like, his processing speed is slowing down or something, and he's instead of just saying, I've already answered that question, I feel like, Dr. Curry or Dr. Hughes would say, I feel like I've already answered that question. Or, no, I didn't base it on Willy Wonka. Just answer the question. Instead, he's like, I feel like we're fighting right now, and I don't want to answer that question. And he's locked mentally, and then he turns to the judge and says, do I have to answer that question? And it's like, I don't think I've shown these clips, but he's done that a number of times, where the judge says, sir, you have to answer the questions. That's how this works. Do you not understand the basics of witness testimony and how courts operate? But meanwhile, he's making these odd mouth gestures, nervous tick. What does that mean? Nothing, really. It means that he, I don't think, has a very slick expert testimony persona. It means possibly he doesn't have a lot of experience, or he didn't prepare. It means possibly that he's just kind of an odd guy. But to the jury, they could look at him and just be like, who is this? Let's rewind that.
You see him in that movie, Charlie and Chocolate Factory? Did you look at that one when you were comparing his processing speed?
Do I have to answer that question, Your Honor?
You have to answer questions. Yes, sir.
No, you'll be happy to know I didn't see Willy Wonka I didn't see 21 Jump Street when it happened. Whatever.
The other thing I'll say is there's a lot of people that will say in reaction to this trial, it's an S show, a crap show, if you will. It is a train wreck. It is a ridiculous. It's embarrassing, or whatever. And what I'll say is this is pretty typical. I mean, it's not universal, what's happening in the courtroom right now. But what I think is happening is that people watch a lot of movies that depict trials, maybe even Law and Order or something, and think that represents what actually happens. Those shows are slick. They're entertaining. They have powerful moments. There's editing and swelling of music. I've seen some ridiculous things happen in court. Things that didn't involve me and things that involved me. I've had judges say ridiculous things, not only from afar, but things to me. I had a judge once claim that she understood family therapy better than I did, and she was making these claims of family therapy that made no sense, even though I was a practitioner, a licensed practitioner of family therapy, and a professor in a family therapy program. She was yelling at me and berating me about things in family therapy that, for no reason really, about things she didn't know she was talking about. And in my head, I'm just thinking, wow, you just demoted all judges in my mind. Now, are some judges totally excellent? Yeah. But the thing to remember is this is a room of humans. To get a gauge of humans, go on the internet. There are a lot of humans on the internet. There are humans in that courtroom. I'm saying internet because you really just see on the internet the full breadth of people's wisdom and self-control and competence. All that applies to judges and lawyers and testimony and expert witnesses. We're human beings. and we are ridiculous, and it shows in the courtroom and it shows on the internet. So this isn't, to my eyes, a ridiculous hearing. These sort of things happen. I mean, I'll tell one tiny little story. For a while, I was being asked to be on jury duty in Seattle. For a while, I was getting requested like all the time. I would go down there, and this is before the internet was really going, and I didn't have a laptop and there weren't smartphones. So you had just to sit in that stupid room and stare at the wall. I didn't even have like a Walkman or something, just like, and you'd sit there all day long and miss work and get paid, I think, $10 for parking or something. When they would, I think they call it voir dire or something, the lawyers would ask me, they would ask all the candidates to see who's going to be on the jury or not. And they would find out that I was a therapist. And I noticed that sometimes they would ask me questions that pertained to the case because they knew that the eventual jurors were in the room and they were trying to get me to say things that would support their case, if that makes sense. Anyway, and I thought, I think you're already litigating right now. So when I got chosen to be on a jury, there were 3 young men who were driving and they got in a car accident and nearly hit other people but didn't. Police arrived, asked who was the driver. Someone indicated they were the driver. They administered a field sobriety test and the individual failed. And then later on, they said, I wasn't the driver. This other person was the driver. And thus, you can't charge me with a DUI because I wasn't driving. The other person was driving. He was sober. So case closed. And so they went back and forth. It eventually gets to court. And the 3 young men, who were probably my age at the time, honestly, it was a long time ago, gave their testimony. They had months to prepare, and all 3 of the young men gave contradictory testimony. They either didn't sit down to confer and make sure that they were going to say the same story, i.e. what seemed to be a lie, or they forgot or something. And I remember just being astonished because that doesn't happen in the movies. The fact that humans are generally incompetent which lends itself to the notion that I've learned over time, that is, if you can avoid going to court, do it. Because once you step into the court, you don't know what's going to happen. I tell this to people going through a divorce. I don't provide legal advice, but I can provide sort of just human experience, citizen to citizen. And I'll tell clients, if you can settle outside of court and you can get most of what you want, then often that is better than going to court. Not only just because of what I'm saying in terms of the chaos, you never know what people are going to do. And 2, that it's a lot more expensive, right? So now sometimes you got to go to court. You got to make it happen because there's no other way to get full justice. But anyway.
Video deposition that he gave, and he took an overnight the night before. And what I think I said was that if you're going to do a major thing toward a trial that you're involved with, I think you'd be an idiot to come in the night before. All right. So I didn't call Mr. Depp an idiot. I certainly called that planning an idiot. I didn't call him an idiot.
So the words, so I mean he's an idiot, are mistranscribed?
No, I'm sure. Again, if I said it in that, if you're just reading one line, one snippet, I'm sure it was in the context I just.
Yeah, I mean, it's just further evidence that he either doesn't have experience or hasn't been around lawyers that really know what they're doing and would really go after him. Because, that's another thing, is that a lot of forensic psychology and psychiatry, the majority anecdotally, are conducted on very, very low profile cases where no one's paying attention to the case. The lawyers aren't funded greatly. There are often public defenders who have several cases on their caseload, and there's a fairly low bar of scrutiny that will happen to expert witnesses, in my experience. So maybe he's done thousands of cases, but he hasn't been around lawyers that will meticulously go after him on certain things, because he doesn't seem to know how to respond. I mean, he's responding mostly well, I will say that. Like, I actually kind of appreciate his candor, but I think it hinders him because in this previous deposition, he said that Johnny Depp was an idiot for coming to the UK trial or something, having been jet lagged. And, you'd have to be an idiot to do that sort of thing. And now he's being questioned about that. Yeah, I would imagine that most forensic psychologists, psychiatrists would agree that you probably should steer clear of that kind of casual language.
Just said, but again, you have it in front of you, I don't.
Yeah. idiot a professional opinion?
I wasn't rendering professional opinion.
Yeah.
No.
Is it a psychiatric opinion?
And that follows the Goldwater rule.
How does it follow the?
Well, you just said that I'm not rendering a professional opinion. I just said idiot. That's not a...
Side note, idiot used to be a sort of diagnosis. So were other words like moron. Over time, people would use the word in a derogatory, insulting way outside of the clinical world. And to us today, words like moron and idiot are non-clinical terms to describe people in a way that you're trying to put them down. But back in the day, they weren't seen as that way. It was a clinical term in the same way that retardation used to be a clinical term, but people started to use it in a way that was insulting and hurtful and discriminatory, and we decided that that word is not okay to use anymore in the clinical world or outside. Because this is something I'm terrified of. That I've been podcasting for 14 years, and I talk a lot in these episodes, and I'm terrified that in 10, 20, 30 years, I will be I know this will happen, that I will be using words that in the future will be defined differently based on how they evolved over time. And I will be labeled as some sort of bigot or something. And so I just want, I don't know why I bring this up, but the reason why it triggered me is to say that is that he's saying, it's not a clinical diagnosis to call someone an idiot or that they did something idiotic, but it used to be.
Idiot is not a professional opinion. Mm-hmm. Is it your practice to describe people as idiots?
In my practice, no, I don't describe people my clinical cases as idiots or patients as idiots or victims as idiots. No, sir.
But you sat for a deposition in this case and described the plaintiff as an idiot, correct?
You gave me 9 hours of deposition, and if I said the word idiot, it was an idiot in planning. It wasn't making him an idiot.
Right. This is why when you are trained and supervised and you gain experience and you learn from your mistakes, you don't say things like that when you're being deposed, because you know that cross-examiners are going to blast you for it, which makes you look not so great in front of the jury.
I don't know Mr. Depp's IQ. I don't know his overall functioning. So therefore, if I said it, it was an idiot in planning, which is what I meant to come across as.
You would agree with me that it's probably a good idea to think about the questions that are asked you in a court proceeding before answering them.
Am I allowed to answer that question?
Yes.
Okay. So what I said by function, I believe that his agent reported how late he was showing up to every movie while the cast is waiting for him. I believe that would be an impairment. If I showed up late for that, I would not be here right now.
Wow. I mean, so he's saying, well, okay, could that be argued? I guess so. I guess what I'm frequently bumping up against with this fellow is I see this a lot where people will make these judgment calls and without any caveat, without any asterisks. And I, even in my practice, am just extremely careful about making a call, making a judgment about someone without knowing more about them. And so he's saying that from the data that was given to him, that he would frequently show up late to filming on movies that he was on, that indicates that he has a deficit in his cognitive abilities. I mean, that is absurd. Or he's saying impaired functioning. Well, even that's absurd because you would have to know that him being late was a product of him having a cognitive deficit of which you don't even know exists. Now, could it be stated with a lot of confidence that his extreme drug use, particularly alcohol and opiates, which are definitely going to interfere with your cognitive abilities while intoxicated, while withdrawing, could one conclude that it's likely that him going through that would affect his functioning in a variety of ways, remembering his lines, showing up to set on time? Yeah, but you wouldn't know that, right? You would just speculate that.
When you're in the middle of a court proceeding, to answer questions carefully.
Again, professionally, we diagnose patients with a neurocognitive disorder by gross evaluation all the time with cognitive, on the thought that, again, age normal controls. I'm just saying, age normative controls does not put a 58-year-old gentleman at that processing. That's all I'm saying. That's all I said.
And you derived this without ever once talking to the man.
You mean me directly talking to him? Because we know how I derived it. So you're talking about me directly talking to him?
Yeah, you never talked.
I've never talked to him.
Right. I said this at the time, and he is doubling down on his statement that he watched Johnny Depp during a trial videotape and not only made a judgment that there was something dysfunctional about his brain processes. So not only declaring that, but declaring that that's a result of the drug use and that it's a decline, which implies that it's permanent, but that isn't what he's saying. Anyway, when people like this do this, and they do it all the time, on the stand, on the internet in particular, I feel like it reflects on me. It makes me, it looks like a hack, and it makes me look like a hack. 2, I don't know if this is just old therapist shakes fist at cloud, but I feel like it's getting worse. I feel like more and more clinicians, this is just anecdotal, are drifting toward dubious proclamations. I feel like when I was coming up in the 90s, me and the people around me were so paranoid about making statements that we didn't have data for. And I feel like there's a lot of people just saying things and using terms that they clearly don't understand. Like I had some of my students will increasingly over time start to use internet language, like they'll use gaslighting wrong or trauma bonding wrong, and it alarms me. I worry about the public, and I also kind of worry about us drifting as a field more towards unprofessionalism, because we define professionalism for ourselves. We to some extent define the standard of care, and I think there's important reasons as to why we have limits on our behavior, and we have ethical considerations, and we have standards that we follow. And I worry that over time, if we continue to go down this road, then the ethical codes will be loosened. One of the things that I see more and more of is licensed clinicians, trained clinicians, master's level, doctoral level clinicians, who try to get their business off the ground in private practice, and either things aren't going well or whatever, and they open up a coaching practice. I don't know the consensus on this per se, but I know that the consensus back in the day, and I know many people agree with me today, that a licensed clinician can't be both. You can't, for me, I can't claim that, because coaches, it's completely unregulated. You can be a 7-year-old child and claim that you're a clinical coach, because coaching doesn't mean anything. Coaching is like claiming you're a superstar. There's no certification or licensure for that label, and coach is the same. Now, there are movements to try to make it a certification or a licensing process, which I welcome. But at this point, the coach means nothing, and there are ethical codes, but you can't be sued because there's not a standard of care around coaching. And what ends up happening in coaching is, anecdotally, a lot of the stuff that coaches do, particularly on the internet when they talk about things, is just completely dubious. And you'll hear people that are clinicians doing coaching claiming that they know the difference, and I'll take their word for it, but the way that they talk, it doesn't seem like they understand the difference. So to me, what a lot of people are doing are, because they're having trouble with the normal pathway of a career, which I don't necessarily, or they're impatient, or they don't like the limits, that they decide to become a coach, because when you're a coach, there's no regulations. You can do whatever you want. You don't have to follow an ethical code. There is no license to take away from that person. You can make any claim you want, whereas when you're a clinician, you're beholden to an ethical code, and if you step out of line, you could get in trouble. Coaches, all bets are off. So when I see clinicians making that transition, I'm like, why? I'm concerned. And so when I hear him and the way that he seems to be playing with the boundaries of what is acceptable, it scares me. All right, well, that does it for that episode. Everyone out there, please take care of yourself, because you deserve it. You really, really do.